Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Welcome to the Medical Collective podcast. We are on our 14th episode, and I'm so excited. I have Dr. Atoosa, Dr. Sharon, and Dr. Leslie with me for this amazing Wednesday. So welcome. The live studio audience on Facebook, on YouTube, and on Riverside. Please join in, ask questions, because we want this to be a nice, light episode, except for the updates. How's everybody doing?
I'm so happy to be here.
I'm doing great.
Doing well, thank you.
Good, right? We always have to, you guys don't know the technical difficulties we have sometimes before we start, but we
They
make
have. Let's be clear.
right? I think everyone, but Dr. Leslie is very prompt. Let's say that, y'all. She's very prompt.
God.
So we have made it, and we want to delve into a couple of updates, okay? Two of them is because of the FDA and difficulty getting access to information. Sometimes people don't hear about recalls as swiftly as they should. And two of them I wanted to share was about the nationwide eye drop recall over sterility issues. Mainly, basically, there is a protocol that's supposed to be followed. And because there was a breach of that, there is a concern about sterility of these eye drops. And it's the AvCare. I don't know if you heard of the AvCare, AvCare with a K. Between 2023 up until now, the artificial tears, the carboxymethylcellulose, and another one, a lubricant eye drops, and an alcohol one.
Several types of.
Sorry. Yeah. So any thoughts on that one? And then another outbreak, just to put them together, is on food. And this is, I don't do ready-to-eat chicken. I don't eat chicken, but this ready-to-eat chicken products that now have a Listeria outbreak. Now, sometimes recalls are caught early, like the eye drops, right? Unfortunately, when there's an outbreak, then you catch it. And in the case of the chicken, and over 10 hospitalizations with this Fresh and Ready Foods LLC outbreak from California to Nevada to Washington. Anything about outbreaks quickly? Any thoughts?
Grow your own. Stop eating other people's chicken. Get your own chicken. In fact, stop eating chicken.
That part, right?
Right?
It is a risk with bird flu and everything else. But I would just say that just because something is labeled as ready to eat doesn't mean that it shouldn't be well washed and cleaned and reheated correctly. So I think some people eat ready-to-eat things directly out of the container and don't do that. But I got to say, it's at least reassuring that food recalls are happening, because if they weren't, then I would think that it was because of the 1,000 employees fired from the FDA's food safety program, and that we aren't actually we're only catching like the tip of the iceberg of recalls. I still believe that. I still feel like we're catching the tip of the iceberg of contaminations when there is enough human illness to prompt the investigation, which is what happened this time. And I think it was local health departments that investigated and figured it out.
I would say ready to eat don't mean you got to eat it. I would say don't eat that stuff, right? Oh, my goodness. We want everything fast and in a hurry. And anything fast and in a hurry is usually not quite satisfying. So I would be very careful.
Touche, Dr. Leslie. I agree. Dr. Sharon?
Yes, I agree with Dr. Leslie. You know, one of the things that's concerning to me is the eye care product recall.
I know.
I don't necessarily use eye drops. However, I do use contact lens, which means I use cleaning solution, right? So to me, if an eye drop can be contaminated on recall, then that can easily happen to the cleansing solution that I use to, for my lens. So that is definitely concerning to me. But at least it's recalled, and it will be off the shelves. So
very true.
I use,
that's a good thing.
I use artificial tears daily. In fact,
it's not that brand, is it, Dr. Leslie?
No, ma'am.
Oh, okay.
No, ma'am. I've never even heard of AvCare, thankfully. So, I mean, sheesh.
It's always.
Well,
Hey,
I'm recommending it
you
always to my patients because I'm an allergist. So I recommend allergy, artificial tears for rinsing allergens out of the eye. So I've been telling my patients to avoid that brand when I'm recommending artificial tears. Normally, I don't recommend a brand, but when something like this happens, of course, I'll warn them. Just like it happened with nasal gel about a month ago, then there was contamination of nasal gel. Briefly, there was 3 months ago, actually, contamination of a Neomed nasal gel, which they caught and cleared up, and it was one batch. But I did warn my patients whenever I hear about stuff like that.
Good. There is a question in the chat on YouTube. Hello to our YouTube audience. You guys can go over to YouTube, The Medical Collective. Is the Food Recall app a good source? I haven't heard of the Food Recall app.
Never used a Food Recall app. What is that? There's a Food Recall app? I imagine that it would put legitimate things that are recalled on there, so it couldn't hurt. And if it recalled all the bad food that you've eaten, then thank God. Come on, use that
You
app.
also can go to the FDA.gov, Google FDA.gov recall, and you can be on a list, an emailer with alerts. Go ahead, Dr. Atoosa.
Yeah, I was just about to say that. I don't know if that's still going to work like it always has, but I have been, as a part of my public health piece of what I do, I have been on that email list, and I used to get recalls all the time. But I've, like I said, have been getting fewer the past 4 to 6 months. But before that, for about 6 months, I had got the most I'd ever gotten. So I feel like there's a trend towards increasing contamination of both our food and medicine supply. So we have to be on alert. And if the app is probably a crowdsourcing thing, I have not used it myself, but I'll definitely check it out and see if it's run by a health department. Sometimes it's run by a state or a county health department. These kinds of things can crop up. And it doesn't mean just because it's an app that it's reputable, but it doesn't mean that it isn't either. So I think just looking into it and deciding what the source of information for that app is important.
And, just do a quick test. Look at the FDA, look at the app. Is it cooperating? Is it converging? That's a really quick and dirty way to see if the information they've got on there. But if they're telling you not to eat chicken, I'm down with it.
True. Very, very true.
Don't eat that chicken, y'all.
Someone said it's a good app, DoorDashing groceries. It gives notifications. And that's one last thing on this that if you do go to H-E-B's in the South or Kroger or what have you, and you're purchasing things with your shopper card, they will alert you because they know what you purchased. So it's good to make sure you're linking that when you're shopping. All right. The next quick update, you all may not know, but Dr. Leslie, I'd love to get your thoughts on this, is that it was just announced that our former President Biden had an exam, and upon examination, they found a nodule in his prostate. They have not biopsied it yet or got results back, but a nodule. And so what should people, when they hear nodule, I think people get scared, but there's more to it.
I think they need to leave Biden alone. Quite honestly, let the man be in retirement. Why are we all up in his prostate now? Why do we need to know he's not running the country? What we need to know is what the president's prostate look like. Okay. So, I mean, what is a nodule? It's just an extra growth of tissue, extra tissue growth. Nodule on the prostate can be cancerous or it can be non-cancerous. The only way to know when there's an issue, you get tissue and we send it off to Dr. Keisha to look under the microscope, determine if it is in fact cancer. You can have nodules because you have an enlarged prostate, which is called BPH, benign prostatic hypertrophy. You can have nodules on your prostate if you've got prostatitis. There are certain kinds of inflammation of the prostate that would lead to, it's called a nodular prostatitis or a cystic prostatitis. So it can be that, or it could be prostate cancer. And, prostate cancer comes in all flavors and forms. It doesn't mean a death sentence by any stretch of the imagination. It simply means that we need to get some tissue, determine the T stage, the N stage, whether it's expanded to, if it is found to be cancer, we need to know if it's involving the nodes, the lymph nodes, and the T stage, how far it's expanded outside of the actual prostate. But I wouldn't be worried. I mean, he's an older man, older gentleman. You know, them things don't be working so good after a certain time. So we let the president live, y'all. How many kids he's got? How many kids he had? Yeah, he had enough children, so the prostate done did its job. Hallelujah.
Yeah, and as you get older, the risk for prostate cancer increases. But do you guys know the main modality by which we find out about prostate cancer? It's through the elevated PSA and what are called targeted biopsies. So I'm not usually seeing nodule found, here's a biopsy, that nodule. It's usually the targeted biopsies that find it, and it's microscopic. Right. So you're not getting a 4-millimeter nodule tumor. It's usually multinodular, multiple biopsies finding cancer. Usually,
and they can do a specific MRI just for the prostate. It's a prosthetic MRI, so it gives you. It's just focused on the prostate, and you can tell a lot with that imaging too. So,
yeah,
let the man be. Yes,
and we shall see what the results are. But I'm sure everything will be fine. All right.
So I found out who runs the food safety app. If it's still something you guys want to know, it's Reiter, Reiter. It's an agricultural informatics company, Reiter affiliated companies. They have several apps. This one they say is designed to monitor for plagues, diseases, to help with running the ranch on a daily basis, used by agronomists to determine if pesticides are needed for dosing and appropriate fumigation. So that's what it's billed as. So I don't know if it's comprehensive, but it might contain a lot of the outbreaks to warn farmers to watch out for contaminations. So
for all of us, though, food recalls, FDA, and Food and Drug and eye drops, look for the FDA. Okay?
Yes.
Great. All right, the next one, quickly, Dr. Atoosa. The FDA is moving. The FDA is busy, though limited staff. They're moving to ban ingestible fluoride supplements for children. I'm sure you've heard about this. They're initiating a process to remove prescription fluoride supplements, tablets, lozenges for children from the market because of potential health risks.
Yeah, so fluoride has been a controversial topic for a lot of years, but decades of use of fluoride have shown that it does prevent and reduce cavities, especially in areas with lower access to dental care and fluoridated toothpaste. Some people argue that there is a lack of evidence for fluoride, but the benefits of fluoridation have been proven in widespread studies. So they also claim that they can get excessive fluoride through drinking water, and they could get enough from other sources such as toothpaste and mouthwash. So that's assuming that everyone has the same level of dental care, dental hygiene, access to care. And in areas, especially with underserved communities with lack of access to dental care, fluoride has been a game changer. And we've seen this in the developing world as well as the developed world. So I think it's going to lead to a lot of tooth decay in kids and adults who don't have access to the kind of dental care and dental hygiene that we all take for granted. Maybe those of us who have more in our lives take for granted access to fluoridated toothpaste and good toothbrushes and dental visits twice a year. And a lot of people don't have that. So I think it's going to lead to more tooth decay in those populations and also down the line, more heart disease. So it's going to make the population on the whole more unhealthy because the cases of overfluoridation and thyroid suppression because of fluoride and all of these other things that are being argued are so few and far between compared to tooth decay that I think fluoride is the lesser of all evils. As a pediatrician and a public health person, I would say fluoridating the water is better. But I mean, if they wanted to do it at a lower level, but just still do it, it would still be better than not doing it at all. And this has been shown that there are some cities that don't fluoridate, and you can compare tooth decay rates in cities that don't fluoridate in the country to those that do, and you can see differences. So I think it's a move towards making the nation unhealthy, not healthy, at least as far as tooth health.
I agree. Yeah.
I would also say, when you compound that with the cuts in Medicaid and just not having access is important. SNAP benefits, healthier foods that would lead to, I'm sorry, I have a ding going on in my thingy here. I think I wasn't sure which computer it was, and I now know which computer, so I don't know how to silence that. But nevertheless, you have SNAP access, food access being limited, dental care being limited, and now you're saying, okay, we're not going to give you what has really proven to reduce the cavities. This is actually going to end up costing the U.S. money down the line. As a leader, one has to have foresight, right? And there seems to be a lack of foresight in the public health arena. And that's all I'll say for now. Thank you.
That's well said.
I just want to add that there are concerns over the microbiome. I'm an expert on the microbiome. I do microbiome assessment and treatment all the time. And that fluoride is actually one of the less impactful things to the microbiome than other things. And improving access to good diet for these kids by not removing SNAP programs would do an amazing job of improving their microbiome. And then I want to just give you as a corollary that not only are they trying to ban fluoride in drinking water, they're trying to ban fluoride supplements for kids, removing a key tool that dentists use to do fluoridation on the teeth of kids, and also give lozenges and other types of fluoride gels to kids who are not in fluoridated water environments. So it removes the ability to even give fluoridation in other ways to developing teeth. So I think it's, like we have been saying, it's going to cause a long-term effect, not only on the healthcare costs of this country, but on overall chronic disease and health, because tooth disease leads to heart disease and other
forget
diseases.
About the chronic care, right? Listen, if you have a daughter or a son who's trying to date later on in life, we're gonna have some issues because
you need the nice teeth.
Oh boy, girl,
that's what's going to get them, though. Yeah,
their grill is going to be jacked up.
or the dentist, cosmetic dentistry is going to go up, up, up. Everybody's going to have dentition.
Let me get into some cosmetic dentistry. It's never too late.
Yeah,
and for those who can afford it, right?
Yeah.
Well, I'll provide care free of cost. Free of cost.
You will barter. Yes.
Yes, barter. It will barter.
Well, we have one more update before we get into the art of medicine. I'm so glad we're having this episode. The FDA has approved Dr. Sharon. And when we talk about public health, and not everyone makes it in, and I already know how Dr. Sharon feels. That's why she's giving me the eye. FDA has approved the first at-home cervical cancer screening test. Now, listen, this is developed by Teal Health, and this is a collection. This is a collection kit called the Teal Wand that enables women to collect samples at home and send them off. Now, number one, this is for HPV testing, right? This is not getting an evaluation. That's part of the pelvic exam. Don't forget that part. And number two, in clinical trials, over 600 participants, the test produced accurate results in 98% of the cases. The product will launch in June 2025. Hi, Dr. Sharon.
Well, hello, Dr. Keisha. So I'm just going to say that it does not replace your gynecologist, right? And, sample size matters, right?
Yes.
Because you can have false positive and false negative. So you should still go see your gynecologist. I'm not really a fan of this. And I think people may use it to delay care going to see a gynecologist, but just please don't let it replace you getting that annual exam from the
Wait,
gynecologist.
who said at YouTube? A doctor
all,
said we cannot even get folks to take a pill. We want them to do a home path.
Right? And the thing is, too, is that, okay, part of the exam is not just collecting a sample, it's actually visually looking at the cervix. Because even if you're there for, let's say, even a pap smear HPV screening, and I see something on your cervix, I mean, that's an opportunity for me to intervene. It's an opportunity for me to say, hey, let's do a biopsy of this. Let's do this extra. Because, this just does not look like it's supposed to look. So at HPV tests, okay, HPV positive, negative, okay. What's
It's a
next?
part of it. I agree with you because when we talk about cervical cancer, most of the HPV related ones we're speaking about is actually squamous cell carcinoma. But did you guys know there's another side to the cervix, which is the endocervix? And endocervical carcinoma, or AIS, which is adenocarcinoma in situ, are not picked up by these tests. And then also for those over 40, when you do a PAP and you get endometrial, what we call endometes over 40, that's not actually the screening tool, but that can be caught as well. So I do agree on that part. Dr. Leslie?
Dr. Sharon, you were so subdued. I thank God for your restraint. Is they crazy? First of all, they're reducing America already to a 6th grade level of education. And they are now asking the average American to do higher educational level stuff. Are they serious? Are they serious? Think about it. I mean, I love the convenience. I mean, me personally, I wouldn't do it. And I have skills, Dr. Sharon.
Right?
I can grab hold of a cervix, right? But I am not going to be doing that for me.
I agree, Dr. Leslie. I would never do that. I would never do that for myself.
Let's say this, everybody. If you can get into your physician, into your gynecologist, please, examination is key. We forgot about breast cancer. Let's not forget about that. Let's not forget about the pelvic exam, also checking the ovaries, okay? But let's appreciate the test for the necessity, but not as a replacement, all right? Not as a replacement. We shall see.
Yeah.
And again, I do agree that the test is as good as the person performing it. And we saw that with C-19, COVID-19, is that people that were performing their own test versus those clinicians, that we saw a better result, so.
But Dr. Sharon, you bring up a really good point that you cannot really replace, number one, the touch, the hands-on, right? And we'll talk about the art of medicine, but the power of touch, our whole body is a living organ, right? The skin is a whole organ. And being able to visualize as well is so important. I mean, how am I going, what we're going to sell speculums now with attached mirror and light? And we're going to sell in stirrups and we're going to, bathroom break, No. Cannot replace that touch.
No, it cannot.
You cannot. Yes. We will leave it at that. And we will get into our main topic, which is the art of medicine and the art in medicine. Thank you, Twiggles. Thank you, Princess. Thank you, Doctor. Thank you, Shawnee, and everybody that's in the chat supporting us on Facebook and YouTube. Now, I divided this into two parts because I think one of them is people don't realize you get out of medical school, you get out of residency, and you practice. And not everything follows the textbook. Not everything follows the training. Not all the tools that you need are there. The patient doesn't fit a specific clinical scenario, and then you're meant to practice. So that's really what the art of medicine is about, is how we practice for Dr. Atoosa in allergy, immunology, pediatrics, integrative medicine, for Dr. Sharon in obstetrics and gynecology, and Dr. Leslie in internal medicine and pediatrics, and me in pathology. Is how do we practice the art of medicine? It's open.
Where to start? I mean, I think we underestimate the power of art. And I would say there's the art of medicine, but there is art is medicine.
Yeah,
And
part
that's
two.
something we don't really even talk about is art as medicine. And, the power of touch, the power of taste, the power of sound, the power of smell, and all the neuro connections that's happening in our brain. And I don't want to geek out on neuroscience, but there has been so much data to support art in even dealing with trauma. There's a book called The Body Keeps Score: Brain, Mind, and Body in the Healing of Trauma. This is good stuff. And I think we're sometimes on the pendulum of corporate medicine so much that we lose sight of how impactful it is to dance and to use art and sound and smell and just the aesthetics, right? The neuroaesthetics in healing. There has been data to support even playing music for patients with Alzheimer's, dementia, and how they light up. It helps in their process then, if you will. So, I mean, I couldn't talk much more about it, but I have seen how it has helped me, even taking little breaks during my daily routine to paint or to dance and to have that, those memories that form from a certain song. That's part of neuroplasticity. That's part of the healing that comes with the art. So I'll stop now because I don't want to. I could take over the whole.
I'm glad you started there because it really is. I had my premise was to have this in two segments, but they really intertwine. The art in medicine is when we're taking our skills and realizing we've got this patient. How can we help them? Right. Outside of the box, people using treatment that you may not think normally in allopathic medicine we should use. Oh my gosh, you're in the middle of a surgery, Dr. Sharon, and it's not textbook, and now all of a sudden you have to use your skills and your ability to do something that normally isn't done that way. Speak to a patient like you talk about in a way you normally don't speak to them. Use tools outside of the traditional tools to help them, guide them, like you said, music and art. And then art, the second part was art as healing, which was dancing and how actually as physicians we have to use art really to make us survive, to be honest, and how we also use that for patients. But I'd love you just to give any thoughts you have, Dr. Atoosa and Dr. Sharon, from either aspect, whether it's, I would first like to hear about how you use your artistic skills to do, and as a surgeon, it's an art to do surgery.
She be carving up that vagina.
Go.
Like a turkey.
Hello, Lois.
Precision.
Well, so, I mean, I've been in situations where I've had to pull from not just my skills that I've used in my experience, but just different ideas of how to save something. And I can remember a specific example. Some years ago, I had had to do a C-section on a young patient, and I never like to do that. So that was like the last resort. And literally, her uterus was floppy like a napkin. So even like the normal techniques that we use wasn't really working. And the last thing I wanted to do was a hysterectomy on a teenager. So then I had to dig deep and find some extra skills and try new techniques to save that uterus and save that patient and get her off the OR table intact.
And it worked, didn't Dr. Sharon?
It did work, but it's just...
And it comes, and you don't even know where it comes from, right? When you're in the middle of that, you have to, this is, first of all, you can't skip step one, everybody, which is the skills and the time put into it in order to get to that level, right? And then it just comes together. I think your experiences, everything.
Yeah, and it does come from experience. And I had a very similar situation, actually, a few days ago where I had to Like, can I have this? Give me this. Go for that. Go. I need this. Need that. Let me try this. Let me try that. I've done this before and it worked. Let me try it on this patient before I ask for a hysterectomy tray. So that's where that art and that experience comes in.
Together.
And that experience, I'm not sorry to say, is not going to come with you looking at your clock at 5 p.m. and say, I got to go because I can't help Dr. Smith with a hysterectomy or a postpartum hysterectomy at 5 p.m. And that's just it.
Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation. Well said, Dr. Sharon. Now, Dr. Atoosa, you're dealing with the children, which you have to be creative anyway. But even in treating them, I'm sure you've came to times where the book is not going to answer it, and you're trying to deal with an allergy or immunological issue with the child. And how do you kind of merge that?
Yeah, I want to talk about infusing the space with art. First of all, Dr. Leslie Ann makes beautiful art. And I find that having art in the space, and if you've gone to a pediatric clinic, there's murals on the wall and there's things that put children at ease. So not just murals, though. I have all kinds of art in my clinic because I feel like even adults respond to it. It creates a different feng shui in the space, a different feeling and energy in the space to have art there. And I have art, and I have a bell hanging when you come in that that they can tap it, the children can tap it, and the bell has a ribbon.
Really quickly, why don't we do this in adult offices?
Well, I mean, I see kids and adults. So, yeah,
I do it.
Some people do. Yeah, so some people do. And I treat adults now as an allergy immunology specialist. So I do it for all ages. And
I would come to the doctor if it looked like that.
Yeah, it's amazing. Like I'll say to the kid, "Are you nervous?" And they'll say yes. And I'll say, "Do you want to ring the love and harmony bell?" And they'll say yes. And they'll ring it, and that sound it's therapeutic for them. It has a clear, ringing, beautiful sound. And it's like wind chimes, and it calms them. But I think that when I think about the art of medicine, I think about the physicians I've admired most and how they embodied healing as not just the therapy plans we give, but with their person, with their persona. I'm a Baha'i, that's my religion, and I was raised in the Baha'i faith. And there's a beautiful tablet that's on my wall called Tablet to the Physician, written by Baha'u'llah, the prophet founder of the Baha'i faith. And in it says, the physician who turns towards God, his breath is healing and his presence is life. And the idea is that we bring life by bringing that sacredness of the art of medicine into the interaction with the patient. So when I treat my patients, I know that I am not all-powerful, that I am an instrument of healing. So keeping that in mind helps. Remembering how my grandfather met people that were very simple and very rural, where they were, even though he was a pediatric, he was an adult and pediatric neuropsychiatrist. He'd done 4 residency fellowships in France and Iran and other places. And he was probably the most highly trained neurologist and psychiatrist in Iran. But the way that he met these rural patients who had very little education where they were and made them feel at home, helped them understand their illness, accepted a bag of onions in payment, that kind of thing. I really remember that. And then I had an oncology attending who she didn't just calm families by what she said. She calmed them by how she walked into the room and the way she sat next to them and touched them on the arm. And I remember admiring her so much. And even I, in my worst days of fellowship, when I would go to the pediatric bone marrow transplant unit and there she was, my day was a little lighter. She healed even me, a fellow, rather than just the pediatrician in her treating families. She also healed her trainees. So I think a lot of healing is in our demeanor, and in our words and in the empathy that we project. And one of the things I've told my patients over and over again is when they tell me their bizarre cluster of symptoms, because I'm often the 10th or 12th doctor someone has seen, and they're coming to me with a medical mystery, I tell them, I believe you, and I won't stop looking till we find the answer. And that I believe you is so powerful because their symptoms have been dismissed and they've been told it's stress and it's all in their head and it's hormones and what, and suck it up. And it's just, you're over 40 and this is how it is. Or to kids, they've been told it's just part of growth or they're exaggerating their symptoms. And hearing, I believe you, makes all the difference in the world. So, and the idea that you are accompanying them and you're not going to give up. So the art of medicine is really about the relationship, the healing relationship between the physician and their patient and their colleagues and everyone around them. It's that healing that comes from being the person in that situation that is willing to go the extra mile and help. Just like Dr. Sharon said, it doesn't matter if at 5 p.m. comes around, your patient needs you. And I think that's the same when it comes to going the extra mile to try to figure out a difficult diagnosis.
I would say that the art starts with you as the physician and being intentional and intuitive and in tune. As a physician, I have to be so in tune what's going on with me and be very honest about it. I just don't do pretend really well. And I feel like when I have brought my real self to an exam room, that I have gotten the real self back from the patient and they realize, oh, she's different. I had a patient say to me one time, use a doctor with a difference. Use a doctor, because, and they question, are you, use the doctor? Oh, you're so different. So, and what they're saying is what they have met was not authentic and there was no connection. We have to be able to connect on a real level with ourselves in order to connect on a real level with our patients. And I think when that connection happens, when there's that convergence, then there is a level of healing that happens that you can't learn in medical school. That healing is human, right? Touch. Just a touch. I mean, we have 10,000 taste buds, right? And to be able to, in your office, share meals with your patient, that's healing. When you're able to break bread, when they're able to smell scents that may bring back memories, soothing. That's healing. We have 1 trillion odors that we can pick up with our nose. That's incredible. And with regards to play is important. It lowers down our guard. It takes us back to some of the, for those who had wonderful childhoods or childhoods where you played, it takes us back to a place where you're like, oh, I can release. I can be me. I can breathe. And what I really think is people are walking through life with their breaths held. They're holding their breath, waiting for the next shoe to drop, waiting for the next grant to cut. We're held in. And when we're walking around with that degree of trauma, because it is traumatic, stress hormones are going crazy. Stress hormones are like, woo, 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 woo. And then we develop dis-ease. So part of the art of medicine is indulging in the art, which is medicine, music, dance, visual arts, even a walk, the aesthetics of beauty. You feel better when you're around beautiful things. When you come into an office and there's running water and you see live plants, you feel better.
And we're going to come there more often.
Yeah.
Yeah.
And when someone makes you
I can get them to like come at your appointment time. You don't have to come a whole hour early. They're coming a whole hour early and sitting down and chatting because they found community,
I love that.
Yeah. And a doctor that's deep in their own connection, like you said, Dr. Leslie Ann, that person radiates a calm that patient then finds soothing just when they walk in. And that's what you were alluding to, that they say you're different. And I always think of Maya Angelou's words that people will forget what you did, people will forget what you said, but they will never forget how you made them feel. So that is, and in your own experience, if we search our own experience as physicians, I haven't always been treated well by other physicians when I was the patient. And I wasn't always listened to. But I remember the doctors that made me feel calm, confident, at ease, peaceful. And those were the best doctors I'd ever had. And I try to learn from them and embody what they did. And I think you're right, Dr. Leslie Ann, because if we don't care for ourselves, we become burned out and impossible. It's impossible for us to be that calm presence.
Also we have to remember that when you get someone out of their comfort zone and you're able to speak to them, that's when you get the information you need, right? And the information that you get from them is helping a diagnosis be made. So in the laboratory, y'all, we are not all data and science and hard, but color, texture, and pattern and information allows us to make a diagnosis, which is not easy. Not every colitis looks the same. Not every cancer looks the same. And it really is in the middle of a frozen when Dr. Sharon's giving me an ovary or something. She's like, what is it? What is it? We literally are using our senses. I'm looking at the history. I'm deciding, okay. And then I'm the doctor too, because the art of communication, my main art is communicating to the surgeon or the doctor. What can I say to them to put them at ease, but not give a definitive, but at least let them know, okay, this is where I'm thinking or going. Right? And we have to realize that, especially doctor to doctor. What is our art of communication? What is our art of communication to the other patient? But for me, it's the art of communication to my surgeons, my clinicians, and what I'm going to put on paper. So I've got to literally sift together all this stuff. And actually, what I look at in the microscope to me is beautiful every day. Literally, sometimes, I get excited. I'm like, oh my gosh, that's so beautiful. Or even organs, they're just so amazing. And we don't know how to put that on the paper to y'all, but it's just beautiful to be able to take that. So yeah, we all use the art of medicine.
Dr. Keisha, if you were to say that to me though, as a creative, I'll be like, yes.
Yeah.
Say, oh my God. And the way this nephron just turned around there and that cell was just like, bam, here I am. I would be like,
was
yes.
And yes, it brings us to the second part, which is the art in medicine. And one of it is artistic art, which if you don't know, Dr. Leslie is a professional artist. But there are pathologists who actually take the microscopic art and have turned it into, I've seen it on their desk, into these frames work, and it's beautiful. But it makes me think of Dr.
textiles.
Leslie.
Like I've seen blouses and shirts with pathology patterns, blood cell patterns. It's really cool.
But Dr. Leslie, how do you use art as a healing? I think for you too, you have actually helped other physicians because Dr. Sharon and I have tried, and I'm like, it actually is very calming and healing. Y'all, we have stressful work and we have to learn how to decompress. And I think art is a great way to do that.
I think we have to be intentional about it. And that's why I say sometimes throughout my day on a break, I would either go down and do gardening. Like I would literally garden for like 15, 20 minutes.
Oh, really?
Or I would go sit and blow some alcohol ink. Or I would turn on the music. Yesterday I was grooving to Earth, Wind, and Fire.
Which is a kind of art. In case people don't know, it's a kind of visual art.
Oh, alcohol ink, it's just
beautiful.
the medium that we use. And I was grooving to Earth, Wind, and Fire. I was feeling myself. I had my tall socks on with my short shorts on. I was just wiggling my little body. But that really does prepare me. I want to read something to you because It says the arts offer a range of effective treatments for individual mental health challenges. We've seen it used with veterans. There are some projects in Baltimore where they've used it with veterans in PTSD and depression, etc. It says here, they improve our psychology by offering enhanced self-efficacy, coping, and emotional regulation. They improve our physiology, which is what we mostly focus on as doctors, right? The physiology, by lowering stress hormone response, enhancing immune function. There you go, Dr. Atoosa. And increasing cardiovascular reactivity. And that's just the beginning. That's just the start of what art can do. I have gotten people to open up about situations in their lives, and this is my one-on-one sessions, right, where we just paint. I want you to remove everything, all the preconceived notions, all the concerns about you're not enough and you're not an artist. Everyone can create art because we are art. We are art. That makes sense. We are art. Dr. Keisha says we're art because she's looking at the art under the microscope. Erudite looking at the art under the microscope. Okay?
The art of the body.
And exactly. And so because we are art, we can create art without judgment. And even to, sometimes it's just a word. You use a word prompt or a color, something that will trigger that the recesses of your mind, that memory, because we form so many memories. Our brain is like, our neurons are like people, like they're outgoing people. They are not introverts, they're extroverts. Neurons are extroverts because they're like, oh God, I need to connect with this one. I need to connect with that one. I need to connect with the other one.
I never thought about it like that.
Yeah, they're extroverts, and that's how they work best. Can you imagine if you had an introvert of a neuron? You, my dear, would be a vegetable. So. I think really and truly as physicians, stop labeling ourselves as, I'm not an artist, I don't know how to paint, I don't know. Everyone can do art because you are art. And so using that to heal yourself, number one. I mean, I painted so much in 2020, I literally was up all night sometimes painting because it just had to come out. All those years of work, and not taking the time that I wanted. And I had prayed and said, God, I just need some time to paint. Voila. He gave me 2020, honey. 2020 just
shut down the world.
Shut down the world and turned up my easel. And it was so relaxing to turn your mind off of things and just focus on, how does this sound make me feel? Because I was painting to music. How does this smell? Because I always burn a candle or have a scent going on. How is this wine tasting? Because I was drinking a little wine and tasting the notes, but involving all of my senses and being really alive in that moment. I think we should really pay attention to the power that art makes in our daily lives. We all have drama in our lives, drama that don't belong to us. We knocking on the door. Hello, can you come? I need to, and to use it as an out to heal in. Yeah.
That's beautiful. And hi to the new people listening on YouTube. Hi, Moments. Hi, Twiggles. Hi, everybody. Alma, it's a pleasure having you in here. We've been talking about the art of medicine, and we also had some updates. You can listen into the podcast on all your favorite podcast platforms afterwards. But as we close, I think, Dr. Leslie, you, to me, embody what the art of medicine is. And you really teach us to all step back. Like, even when I was getting on here and getting anxiety and all that, we really do have to step back. It's going to be okay. And one thing that allowed me to make it through was dance. And so in
Yes.
performing arts, when I was
too.
in medical school,
Me too.
I had always had this connection that I wanted to learn more about where I came from in African dance. And I met somebody. And from that, 25 years of dancing and in medical school. And I made sure if I studied, I'm dancing. And I'm going to tell you guys, that allowed me to make it through. And to this day, I still take classes with my mentor and still dance because it is the most healing ever. I think I probably would have had meltdowns. Medical school is not easy, and all of us have our stories, but that is literally what made it through. And so I love encompassing art, and I think a lot of us we think we're left brain, there's a balance, and we just haven't tapped into it. We are as much right brain as we are left brain. I don't know about you, Dr. Sharon, but what artistic...
She is.
She is. She always says
She
she's
is
not
artistic.
everybody.
She over there carving faces and vaginas. She's artistic.
Oh my goodness. I never really thought that I was artistic. I've always been dexterous, and I've been told that since I was young. And I was always good with my hands. And even in medical school, where a plastic surgery fellow tried to get me to change to plastic surgery instead of OB. So, I've always had, I think, good hands. For me, my artistic or creative outlet is, I think, just photography.
That is an
And
art, is it not, Dr. Leslie?
well, yes, it is. Okay, I will agree with that. And I even did promise myself that my photography needs to come out of my camera and be on a wall somewhere, because I've had just even beautiful pictures just from here within the United States, the Grand Canyon. Good photography from my safari trip to Africa, and just even macro photography with insects and flowers and things like that. So that for me is a creative outlet, and I don't think I'm doing a whole lot of it currently, but I will return to it and do more of it, since I actually do have a little bit more time.
Good. We'll be waiting. We're definitely going to do a part two.
Mm-hmm. That is so good. Like, totally. Photography, are you kidding me? Because you have to have an eye.
You have to have an eye.
And what does it do to
and
you
the
when
lighting
you do it?
And the,
you know? Because I got 30 million pictures on my phone and put in my camera. Because, listen, we are constantly saturated with experiences that influence our perceptions and alter our mental states. We see that in America today. We see that all around us. There are all kinds of things coming at us that will alter our mental state. Our senses are always cross-talking. Your sense of smell, your sense of taste, touch, which we didn't talk about touch and oxytocin, right? Which is really important in medicine. We gotta touch our patients again. We've gotten this telehealth business. We don't touch our patients enough, right? But they create unique impressions and feelings about our world. When we put the arts to use, they help us to amplify the positive emotions, like joy and happiness. Like, when is the last time you felt joy? When is the last time you felt like happiness, giggles, just rolling over, laughing for no reason, yeah? Helping to usher in an overall sense of well-being. I think this is the art of medicine, and this is the art in medicine. And this is art as medicine.
I need like a clapping machine for that. That was beautiful.
Right? Yes, we do.
That's going to be a clip.
And let me tell you, I've never been a painter, someone who draws. I don't possess that talent. But during the pandemic, Dr. Leslie had art classes.
She
What would
did.
they call? Art with the Heart?
That was fun.
Yep.
Right, where we would get together on Sunday evenings and paint. So I have acrylic paint, I have watercolors, I have pencils, and I can tell you that was so therapeutic, and that helped me so much. Right, so it does help, and especially the time during the pandemic when it was so hard for us as physicians,
Yeah.
it really truly helped me.
It was hard.
Yeah.
Yeah.
Yeah. So I still got my paintings. I still got my easel. I still got all my watercolors. So we need to paint.
Yes, we
All right.
do.
This
Amazing.
Sunday at
do.
7.
And
Let's
I will,
go.
in the show notes, I will make sure I link to what Dr. Leslie does and maybe one of the classes, Dr. Leslie.
Sunday at 7. I'll send out
Yes.
the Google Meet invite.
Dr. Atoosa, did you have any final thoughts?
Yeah. What that you don't have to be good at art to do it, and I think that's
Because I can't draw.
I've been I reinitiated my my violin training a year ago. You know, I played the violin.
You.
Yeah, so I played the violin when I was a teenager, you know, starting at 11 years old. And I played pretty avidly for a few years and was in orchestras and all district and all region. And I was supposedly good for my age. And then we moved away from my favorite violin teacher, and my inspiration, I think, was him. So I really stopped practicing, stopped playing for myself. And by the time we found a teacher, I'd gotten busy with so many other extracurriculars, I never took it up again. And in adulthood, I tried twice to find a teacher and to restart. And I think I never had the right connection. Just like a doctor, you have to have the right connection. So a year ago, through a friend, I found a teacher, and I think we have the right learning connection, educational connection. So I, for the past year, have been trying to play the violin again. And of course, there's a big difference, you know, 30 years have passed. There's a big difference between how good I was when I was a teenager and now. And also, as an adult, you realize that what true talent is versus what the dexterity and hubris of the young and the, you know, alacrity of learning, the fast learning pace that a teenager is capable of doing. So anyway, I found out that I'm not as talented as I thought I was, which is okay. Not that my teacher said that. I came to that conclusion. And I still enjoy playing, and I still enjoy making music. And I had to push past that part where it didn't seem like I was making music. It just sounded like I was making noise. And I had to push past that to the point where now when I play, it sounds like music. And again, you know, when I was younger, I played less as a soloist and more as part of an orchestra. So I enjoyed that more. And I'm starting to collaborate and play duets with my nephew, you know, who plays the piano and guitar. So I do think it's important for people to realize that you don't have to be a good artist by a technical or even inspirational standard to be an artist. And what Dr. Leslie said is echoed by what Pablo Picasso said, is that every child is an artist, and the trick is to keep being an artist as you grow up, right? And not have that beaten out of you or told that you're not good enough to practice art. So I think it's important. And one of the main reasons I continue is that I connect with my nephew through music. But the main reason is myself. And I feel that when I have an artistic pursuit like dance and music, I do dance as well, like Dr. Keisha, not as seriously, but I'm a tango dancer, and you know, I do love to dance. That kind of artistic pursuit puts us in touch with a spirit, a creativity within ourselves, which then will be channeled into the interactions with our patients and make us
better physicians.
in medicine. Yeah, it will. But it will also make us more balanced human beings and better able to handle the joys, the stresses, and the setbacks of life. And will reassure us that we have a creative space within us. Again, it doesn't have to be technically perfect. Find an artistic expression is my advice, whether you're in medicine or not.
Well said, Dr. Atoosa. Any final thoughts, Dr. Leslie?
I always want to stay away, and that's when people do art with me, which I realize is kind of mindful-based art therapy, because I ask you to suspend your judgments. Suspend your judgment of what you think is good and just really paint from your heart. And you can't say that art from the heart is bad, or it's not good art, or, it's art. And I remember going to the art museum in Rome. We're in Rome one October. And there was a canvas with red paint. And that was it. It was hanging in a prestigious museum. And I thought, it's red paint. But someone beheld it as great art. And so the stick figures that you may draw, which Jean-Michel Basquiat drew, which you try to buy a Basquiat now and you see how expensive it is, it's considered great art. So don't judge your work because your work is coming from a place within. And if it's coming from you, it's good. God created you and he said it was good. So it's coming from you, it's good. Don't judge it. There's no good or bad. Art is art. There's some songs out there, and it may not be your flavor, but it's still art. And we suspend the judgment, because I think the judgment part is what keeps people from indulging. Yeah? It's like, well, I'm not an artist. I'm not going to be good. Stop with the narrative of that. You're great. What's coming out of you in an authentic way is amazing. We like it. We want more. We want more of it. So
that's beautiful. And if you all want more of us, you can tune in for the next episode. Thank you, Dr. Leslie. That was beautiful and well said. So thank you all for coming in. Dr. Sharon, Dr. Atoosa, Dr. Leslie, it was a pleasure. And all of those that listened here and will listen on the podcast, stay tuned for the next episode. In the show notes, Dr. Leslie, I will make sure I put some links to your information, your art, as well as to everyone else. So thank you all and have a great evening. Thank you for tuning in to The Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.